In this video, we will explore different types of OET writing, one of the most important tasks in the exam. Here's the deal. You will get a set of case notes about a patient, and your job is to turn those notes into a clear, professional letter. The letter could be a referral, a discharge note, or a transfer. Now, many students panic. What if the case notes are huge? What if I miss something? Don't worry, I'm going to show you my one patient, three letters trick. We will take one set of case notes and I will show you how to write three different types of letters out of it. And remember, we will keep it simple, clear, and professional. That's what OET examiners want. So let's get into the case notes. Here is the case note. Patient Mr. William Carter, 58 years. Background is lives in Toronto with wife, works as an accountant. Medical history, hypertension 5 years, obesity, BMI 32. Presenting problem is shortness of breath, ankle swelling, fatigue for 2 weeks. Findings are BP 160 by 95. ECG shows atrial fibrillation, mild pulmonary edema on chest X-ray. Hospital course stabilized with diuretics plus beta blockers, monitored for arrhythmia. Now the progress is improved after 5 days in Toronto General Hospital, and the plan is needs ongoing management, follow up with cardiologist, strict diet plus exercise advice, continue medications, which is furosemide 40 mg daily and metoprolol 50 mg BID. Okay, now let's turn this case notes into a referral letter first to a cardiologist. So here is the first letter, a referral letter to a cardiologist. 1st October 2025, Dr. Sarah Thompson, Cardiology Department, Toronto Heart Institute, Toronto, Ontario. Dr. Dear Thompson, I'm writing to refer Mr. William Carter, a 58-year-old accountant who has recently been treated at Toronto General Hospital for atrial fibrillation with associated symptoms of fluid overload. Mr. Carter presented with shortness of breath, ankle swelling, and fatigue persisting for 2 weeks. On admission, his blood pressure was 160 by 95 mmHg and ECG revealed atrial fibrillation. A chest X-ray indicated mild pulmonary edema. His past medical history includes hypertension for the last 5 years and obesity, BMI 32 within the brackets. During hospitalization, he was stabilized with diuretics and beta blockers, and his symptoms improved over a period of 5 days. At present, he remains stable of furosemide 40 mg daily and metoprolol 50 mg twice daily. Given his cardiovascular risk factors, recent episodes of arrhythmia, I would appreciate your expert assessment and recommendations for long-term management. Thank you for your attention to this matter. Yours sincerely, Nurse Emily Parker, Toronto General Hospital. Okay, let me tell you why this response get you a high score. This one works because it's clear, formal, and focused. I have included the patient history, current treatment, and exactly why he needs a cardiologist, the reason, right? You can notice the linking words such as during hospitalization, at present, given his risk factors. That's what examiners love, which means the smooth flow. Okay. Now, the second one, we are going to change the same case notes to a discharge letter to the family doctor. Now, the same patient, but this time a discharge letter to his family doctor. Same date, Dr. Michael Reynolds, Maplewood Family Practice, Toronto, Ontario. Dr. Dear Reynolds, I'm writing to inform you about the recent hospitalization of your patient, Mr. William Carter, a 58-year-old accountant who was admitted to Toronto General Hospital with atrial fibrillation and signs of early heart failure. Mr. Carter reported progressive shortness of breath, ankle edema, and fatigue over the past 2 weeks. On examination, his blood pressure was 160/95 mmHg and ECG confirmed atrial fibrillation. A chest X-ray revealed mild pulmonary edema. His medical history is significant for hypertension and obesity. He was stabilized with furosemide and metoprolol with notable improvement during a 5-day hospital stay. He is now being discharged in stable condition on furosemide 40 mg once daily and metoprolol 50 mg twice daily. Please review his medications, monitor his blood pressure and cardiac rhythm, and reinforce adherence to dietary modifications, weight management, and regular exercise. A follow-up appointment with cardiologist has also been recommended. Thank you for your continued care. This one is the perfect response because it gives the GP all the information needed for the continuity of care. The diagnosis is given, the treatment given, and the discharge medication, lifestyle advice, everything is given in this letter. It's around 190 words, exactly the sweet spot for OET. Okay, now the third one, the transfer letter with the same case notes. So this is the transfer letter for the same patient, this time to a cardiac rehabilitation clinic. So the date and Miss Laura Bennett, Cardiac Rehabilitation Unit, Toronto Rehabilitation Center, Toronto, Ontario. Dear Miss Bennett, I'm transferring Mr. William Carter, a 58-year-old accountant, to your care following stabilization at Toronto General Hospital for atrial fibrillation and fluid overload. Mr. Carter was admitted with 2 weeks of breathlessness, ankle swelling, and fatigue. Investigations revealed atrial fibrillation on ECG and mild pulmonary edema on chest X-ray. His history includes hypertension and obesity. During his 5-day admission, he responded well to diuretics and beta blockers, and his condition is now stable. He has been discharged on furosemide 40 mg daily and metoprolol 50 mg twice daily. Given his cardiovascular risk factors, he would benefit from your program for lifestyle modification, structured exercise, and weight management. Please support him in developing a sustainable plan to improve cardiac health and prevent recurrence of symptoms. Thank you for accepting this referral. So this letter nails the purpose. The examiner wants to see if you can adjust your writing for the right audience. Notice I did not just repeat the hospital story here. I have just emphasized why rehabilitation is required. That's the examiner's gold mine. Okay? So there you go. One patient, 3 different letters, referral, discharge, and transfer. Same case notes, but 3 different purposes. That's how you prepare smartly for OET writing. Remember to keep it clear, logical, and professional. Don't try to sound too fancy. Just write what another healthcare professional really needs to know. That's how you will score a B or even an A. That's how you will score an A. Okay? That's how you will score higher. Okay, so that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye-bye.